Hello, I'm Dr. Michael Kelley. I'm a licensed psychologist, a board-certified behavior analyst at the doctor level, and I'm an educator, a trainer, a clinician, and a researcher. The importance of monitoring your infant or toddler for autism and then taking action if they are showing signs cannot be overstated. You can make a difference that will last a lifetime. If your child has been diagnosed with autism or is showing the signs of autism, it is critical to take immediate action. The sooner a child gets help, the greater the chances for learning and progress. From birth to approximately 48 months, your child's brain is still forming at a rapid pace, meaning it's more plastic or changeable than at older ages. Because of this neuroplasticity, actions you take between 18 and 48 months has a great chance of being effective in the long term. These early interventions not only give your child the best start possible, it's also the best chance of developing to their full potential. Early intervention helps children gain the basic skills like physical skills, thinking skills, communication skills, social skills, and emotional skills. If you suspect autism, you should seek professional help as soon as possible. Autism screening is an essential tool for monitoring how your child is doing. And despite what some people might tell you, sometimes even including healthcare providers and pediatricians, the American Academy of Pediatrics recommendations are crystal clear. All children should receive screening, no exceptions. The American Academy of Pediatrics specifies that all children receive screening for autism at the 18 and 24-month well-child visits. Thanks to these recommendations, these screening services are covered by virtually all insurance plans. The importance of developmental screening for all children cannot be overemphasized. Studies show that screenings are accurate, and research shows treating children earlier for autism can help mitigate its effects. Screening can also identify at-risk children early, when they may benefit most from intervention. For screening to be effective, however, it must be applied to all children, not just those showing symptoms. Screening occurs prior to diagnosis. And just because your child has a positive screen for autism doesn't mean he or she will actually be diagnosed with autism. For screening, most pediatricians use the MCHAT. It's a short questionnaire that parents fill out. Most families find it very easy to complete. You can even take the MCHAT online at home. It takes less than 10 minutes. Using this standardized screening tool, pediatricians can identify children who are at risk for autism, which will prompt follow-up conversations about how to monitor language and behavioral development, as well as those next possible steps, which might include a formal diagnostic assessment. The online MCHAT will calculate the results of your child's screening information and provide to you a very clear recommendation to either retake the screener in a month or perhaps to see your doctor or psychologist as soon as possible. As a parent, as an advocate for your child, you should politely insist that your child receive the MCHAT screening for autism at the benchmark ages of 18 and 24 months, just like the American Academy of Pediatrics recommends. And remember, screening tests don't always identify all children with autism. The rate of success for the MCHAT isn't 100%, so it should be used in combination with health and family histories to identify children who are at risk. Remember, there's no judgment call to be made about whether or not to screen for autism. The American Academy of Pediatrics guidelines are explicitly clear that all children should receive screening for autism and related developmental disorders. Your opinions as a parent are irreplaceable, they're critical, they're of the utmost importance. If your child screens normally, but you continue to worry about autism, do not be shy with following up with your pediatrician to rescreen.